Hi, I want to start off by asking you to do a very simple thing. I want you to close your eyes and imagine you're in the later phase of your life and now you are diagnosed with a terminal illness. What do you do from here? That's what we're going to address today. We're going to address real situations that affect real people all over the country and all over the world and the options they have to impact not only themselves and their families, but the people of the whole country, and how this translates into you. My name is Karan Sarai, and I'm going to be talking about how your care costs you and others around you. The focus of what we're going to be talking about today is waste and what we could do to eliminate the waste in our healthcare system to make it better for ultimately everyone. Now, we have a healthcare system that's worth about $3.4 trillion worth of national spending, which is 18% of our GDP, and this amounts to, on average, $10,500 per person. 30% of this is waste, which amounts to slightly over $1 trillion, and about $3,500 to $4,000 a person. We're going to talk about waste from the perspective of two participants in the healthcare system, the perspective of the patient, which is mostly us, and the perspective of the physician or the caregiver. And we're going to start off with the patient. So here I have death spending, because death spending is where we spend almost 80% of our money when it comes to our care over a lifetime. And as you can see on this gravestone, I have put $200,000 here because this is metaphorically a lady that spent $200,000 on care that ultimately was not able to prolong her life significantly, and it ended in her inevitably going to the grave in the same way that she would have. Now, most of this death spending that I referred to earlier happens in the intensive care unit, and statistics indicate in 2016 that's where about $200 billion worth of waste went just on the care in the ICU. That's about 20% of our total waste, and probably more now here in 2018. So we need to do what we can from the patient perspective to limit waste. And how do we do that? I think it's by having simple conversations and creating clear-cut directions and guidelines of what we want to happen if we're put into situations, or if other family members are put into situations where they're facing death. So here we have an example. We have on the left, let's say that this man, his name is Bob here, and Bob is faced with the terminal illness that we looked at earlier. And Bob, however, has made clear-cut guidelines with his family that he does not want to pursue any unnecessary care that's not going to prolong his life or not give him a significant chance of life. Now, ultimately, Bob does end up dying, but he doesn't put too much of a burden on his family, or does not end up spending an unrealistic amount on care that ultimately won't prolong his life. Um, at the end of the day, he ends up dying. And then we have the person on the right who, let's say that this is Jeff, the adult here, and his son, and their father has died. However, they did not have a simple conversation. So there's no clear-cut guideline here, no clear-cut direction. And their father's faced with a terminal illness, the same one Bob is, and they just pursue every length of care that they can. They go as far as they can to ensure that the father survives, because that's human sympathy and human empathy right there, that we just want the best for our family. And if we can spend more time with them, if we could just be with them longer to say what we need to say, we'd pursue that. But inevitably, that leads to more money being spent, and it's going to burden on the son. It's going to burden on the grandson. Now, ultimately, he has to pay for that care because the insurance is not going to pay for it, or the hospital will have to relinquish the debt at some point, which leads to more waste spending for everyone, and that falls on you and me and people outside of his family, because that's just more waste in the healthcare system right there. So here we're faced with two different scenarios, and I think the solution is simple conversation. We could fix a lot if we know what our family wants us to do when they're put in these situations. Then we could follow them, and it's still going to be sad. Death is not something we want to face. It's something we want to avoid at all costs. We want more moments with our loved ones. We want to say what we want to say, but ultimately we all can't cheat death. And if we have these clear discussions earlier rather than later, and honor them, it could lead to lower waste spending, and it could actually create a more effective healthcare system that at the end of the day could help more people, instead of harming more people. Next, we're going to look at how we could handle waste on the physician side of things, because it takes physician and patient working in unison in order to tackle the waste problem in the United States healthcare system. So here we have an example of a blood transfusion. This is the most frequently performed procedure in the country, and it accounts for about $1 million worth of waste per hospital per year. Now, according to the Joint Commission, half of these blood transfusions are unnecessary and might carry more harm than risk, which we have here as listed as like allergic reactions, fevers, iron overloads. So then why are we doing them? I can't answer that question, but we can definitely cut back on them and limit this waste, because if we could save half of the spending, then that can amount to hundreds of billions of dollars saved on blood transfusions alone, which can save so much waste in the healthcare system, considering we have $1 trillion worth of waste. Now let's go back to the intensive care unit from the physician's point of view. Dr. Dong Chang, a director of the Medical Intensive Care Unit at the UCLA Medical Center in 2015, decided to conduct some experiments around the region over hospitals using the ICU. And what he found was really scary. He found that hospitals were overusing the intensive care unit, where resources are already scarce, and it's basically becoming a deathbed for people. And according to the experiment, for less than 100 hospitals across 2 states, it was Maryland and Oregon, limiting the ICU use to only serious use would save $137 million for these hospitals alone. So less than 100 hospitals across 2 states. So we have over 4,000 hospitals in the nation. So this would lead to billions of dollars saved if we limited usage of the intensive care unit. One of the examples he found was for patients with diabetic ketoacidosis. One hospital put 16% of these patients in the ICU. Other put 81% of these patients that suffer this disease into the ICU. So this just fills up the bed, and this just takes resources here that ultimately could lead to more waste spending when we could actually put in patients that need ICU care, that don't get it, rather than patients that could be cared for in other areas of the hospital. Lastly, we're going to look at this topic of aggressive care, which can be defined as any unnecessary testing or care. So it's kind of what we've been talking about. But aggressive care can lead to over 30,000 deaths per year. I think it definitely expedites them. And the total waste comes to over $200 billion. In one hospital in California, they found out that most of their doctors were ordering daily blood tests for patients in the ICU. So they decided to try and cut back on this until they finally did away with the button that orders all these daily blood tests. And they found that they cut unnecessary testing by more than 10%. However, this took time. The doctor in San Diego said that progress was really slow, but it shows encouraging signs. So now we're left with what do we do? And I think from the patient side, like I said, it takes simple conversations in this death spending arena, where we spend 80% of our lifetime healthcare spending in that last phase of our life. It takes simple conversations to clear the air about what we want to happen during those last phases of our life. And these are tough conversations to have, but they're necessary, because otherwise there's doubt, otherwise there's clarity, and we don't know what do we do when it comes to our loved ones, and we want the best for them, but ultimately their wishes need to be honored. And if we could limit the spending in that arena, because we have these simple conversations, it'll do good by us, do good by our families, and do good for the people of the United States, not having to spend more for our care that's not helping us to begin with. And I think from the physician side, it takes moving forward. It takes, we need to meet the curve now and get ahead of the curve. We have the research, we have the data that indicates that this isn't helping. So we need to advance. We need to apply the data now because it's already there. We need to apply it, and we need to move forward. And if we could do this, we could limit, I think I counted up about $600 billion worth of waste, if not more, in a system where we waste $1 trillion. That's over half our waste right there. If we could fix it with these solutions, and ultimately it'll provide better days for everyone in America. And earlier on, I indicated stats that we have $1 trillion worth of waste, and we spend on average per person in the U.S. $10,500 in our system. That amounts to about 3,500 to 4,000 worth of waste. If we're wasting that much and we can limit that to about $1,000, it will provide a better quality of life for everyone, and we can ultimately help more people in our healthcare system, which is what we should be doing at the end of the day. We should be providing a system that helps the most people for the most efficient way possible. Thank you.